Hello, volunteers of Clinic with a Heart. We're showing you this video to show you some changes we're thinking of in how the clinic flows. And the reason we're looking at that is so our patients have as much dignity as possible. Have you ever noticed there's areas of the clinic where we get in clumps? If you're a patient, it can be intimidating to walk into the rooms where there's lots of people looking at you. So hospitality, dignity, and grace are the reason we're working on these videos. So the first thing that'll happen when a patient comes into the clinic is there'll be a greeter standing on the main floor at the top of the stairs. And the patient will check in with that person. They'll have a tablet and make sure that their appointment time is within the next 5 minutes. If it's within 5 minutes, the patient can proceed downstairs. If not, we'll ask them to come back closer to their appointment time. That helps keep some distancing between people and keep our waiting rooms as free as possible during a clinic.
As a patient guide, it's going to be important for us at the bottom of the stairs to let the patients know where they need to go now. So we're going to go over here into what is currently the intake discharge room for them to be checked in. Before clinic even happens, there's stuff that happens with patient charts and getting them ready for clinic. That will happen elsewhere, but here is where that big front desk would be, and someone would be sitting here and asking, "Hi, what's your name and what time's your appointment?" and marking them yes on the clinic night appointment book. Then the charts are ready to be started for the process, and vitals will come and get the chart and the patient, who will be also in this room in a waiting area to go to vitals.
So the next thing that'll happen, this will be a waiting room for our patients who have checked in. The vitals person will come get the patients from here and take them back to what will be our vitals room. Now, right now, it's physical therapy and chiropractic. That'll move to where vitals is, but this will be our vitals room. Once the vitals are done, if there's an intake or discharge nurse ready, the patient will go right to that area. Otherwise, they'll go back to the waiting room. Now, one thing we have to do is put a door in right here. So this will take the patients to intake and discharge. We'll show you that area next.
So this waiting room B now becomes intake and discharge. The new door is going to come in right here, and a patient guide will let the patients know when there's an intake or discharge nurse available. In this room will be 4 intake and discharge tables with some kind of dividers, because we know that there needs to be a little more privacy involved with that. After this, another patient guide will take them to the waiting room, and we'll know that when they're in the next waiting room, they're ready to see a provider.
Now this will be a little mini waiting room right here. So this desk will be gone. We'll move these file cabinets. So this will be the waiting area for patients who are here for mental health, chiropractic, PT, and dental services. Other patients will come back to what we call waiting room A right now. So this will look very similar to how it looks right now.
The provider assistant will come and get patients from this room to take them to exam rooms to see medical providers.
So now the rest of the clinic looks pretty much the same as it did, but you'll notice that we're going one-way traffic through the clinic, so there's not a lot of crisscrosses between patients going from station to station. So this looks pretty much like it always has looked. The exam rooms are where they have been. Pharmacy is where it has been. The big difference is this office will become an additional exam room.
When the patients are done with whatever services they're here to receive, copies will be made if necessary, and then they'll head back over across the hallway for discharge now, and that's where the patient shop will be. No worries, volunteers still check in the same place on the touch screen.